Hello and welcome. You're watching our show Coronavirus Facts versus Myths. I'm Gargi Raut. First, let's get you the latest data. And India has reported 32,937 new cases, which is 8.7% lower than yesterday. And the country also reported 417 deaths in the last 24 hours, taking the cumulative death count now to 4,31,642. The daily positivity rate was recorded at 2.79%. It's remained below 3% for the last 21 days. Let's now take a look at India's vaccination numbers and the vaccination equation, as well as we like to call it. The daily shortfall in the last 7 days has been 5.3 million a day. That's 53 lakh a day. Remember, we need to be vaccinating or giving at least 1 crore doses every single day if we're to vaccinate enough people by the end of the year, at least an adequate number of people, a proportionate amount of people that will protect the population and lead to the COVID pandemic waning. The vaccine shortfall in the last 24 hours is 3 million a day. Now, the total deaths, that 4,31,642, which have been reported in the country so far, 1,35,000 were from Maharashtra, 36,979 from Karnataka, 34,000 from Tamil Nadu, followed by Delhi and UP, and then Kerala and West Bengal. The Health Ministry has stressed that more than 70% of the deaths have occurred due to comorbidities. But experts have been saying that India's death numbers are much higher than what the official count is, that India's excess deaths during the pandemic could be a staggering 10 times the official toll, is what has been claimed by some, and it's likely to make it India's worst human tragedy. Well, to talk more about these numbers and claims about the deaths, we're joined by Dr. Murad Banerjee, senior lecturer mathematics at Middlesex University, London, whose graphs we're just sharing there, who's come out with a fresh set of numbers on excess deaths during the last 2 years and taking 2019 as a base, and we'll just get you to explain those numbers to us. We also have Dr. Chandrakant Laheria, epidemiologist and health systems expert, and someone we've been speaking to constantly during this pandemic to talk more about the importance of numbers and, all the talk about the third wave and what excess deaths would mean. Now, Dr. Banerjee, first, if you could explain to us, these numbers that you've come out with, saying that for every 3 deaths that have taken place, there was 1 more death that has not been counted, and you've talked about excess deaths during these last 2 years during the course of the pandemic.
Yes. So just to be clear, it's what I'm claiming is that for every 3 deaths which would normally occur, there's been an extra death which has occurred during the pandemic. So if you like, it's an extra pandemic death. So that's about a 35% increase in mortality during this whole pandemic period, starting from April 2020 up to June 2021. That's as far as we have some data for. So that's actually a huge surge in mortality. It means that cumulatively there have been, I estimate, somewhere between 3.5 and 4 million deaths. Most of the assumptions behind that estimate are actually quite conservative. They tally with other people's expectations, other people's estimates as well. So this is not just kind of my own estimate, it includes other people's estimates as well, and it's based mainly on civil registration data. In fact, these estimates are based on that data alone.
Right. If you could tell us where, how you collated this data and from which states. We know it's from some particular states that you managed to get the data. And I remember even, at the start of the pandemic, or when we were, in 2020 at that time as well, a lot of experts, a lot of, academicians, doctors, they spoke about the need for data, especially death numbers from previous years as well.
That's right, yes. I mean, this data is basically collated from public sources. It's publicly available data that journalists have managed to get hold of by different means from different states. The estimates that I've come up with are based on data from 12 states, which comprise together about 60% of the population of the country. So there are some missing states, which are obviously important, and the estimates could change as a consequence of data from those states. So obviously, actually, excess deaths estimates are always estimates. It's important to point that out. You can't say with certainty how many extra deaths have occurred, but these are the estimates based on the available data from these states.
All right, Dr. Leheria, what would your comments be on this? Because this is something that has been claimed for a while, ever since the devastating second wave as well. You know, there was talk of excess deaths. We did see those visuals from Uttar Pradesh and, you know, all these allegations back and forth between Bihar and UP about the bodies that were found floating in the Ganga. So, and also explain to our viewers why it's so important, you know, to really have these figures to know the true extent of the pandemic and how devastating it's been and where all it's affected.
So I think we need to be clear on one thing, which is that before the discussion today, we were talking about excess deaths in context of COVID-19. And that's where we were hearing that number of deaths exceed by 1 to 10-fold of officially reported deaths for COVID-19. However, what Dr. Murad Banaji has done appears to be all-cause mortality. And in all-cause mortality, there is for every 3 deaths which were happening in the past, there is 1 excess death reported during 2021. So these are the 2 different things. This 1 extra death for every 3 deaths are at all-cause mortality cannot be attributed to COVID only. This we don't know. We need to understand more. While the other deaths reported, excess deaths are for COVID-19. Other part is that while this kind of analysis is really important, that's how we will arrive on the real estimates of all causes deaths as well as COVID-19 deaths. We also know that globally, even the organizations such as World Health Organization has said that of the officially reported deaths are underestimated for all countries, be it United States, UK or any other country. The multiplication factor will vary. For United States, UK, the WHO say that it could be 1.5 to 2-fold. But for rest of the country, it could be 3-fold, 4-fold. So all countries are under-reporting, or all countries could have an excess death. That's what we need to remember. Final part is, I think this analysis based upon the available data, CRS and other systems, has its own challenges. For example, this analysis is based upon 12 states information. Now we know that if some individual, it's not necessary that individual need to register in the same state where death has happened. For example, Chandigarh has reported very high number of registered deaths, while those deaths could be from Punjab, Haryana, other parts. So we should be mindful, and when all the data from different states would be available, those will be reconciled, like Dr. Banerjee also said.
Right. All right, Dr. Leheria, but also the reason that we need this data, because, you know, there's been so much back and forth, and you know, the government has also challenged some of the estimates that have been put out by various experts. But this is something that we need to know, because to understand the extent that the pandemic has affected different parts of the country, and, you know, and especially if we're talking about a third wave, which parts have already had, you know, rampant infections.
Exactly. So we definitely need to get an understanding of how many excess deaths are happening, because this is very important parameter. One, it provides indicator of that how health system in particular state perform. It's like the way a doctor touches the pulse of a patient and then decide the health condition. Similarly, if we know the excess death, we know the pulse of health system, that if there were excess death, the health system was not performing well, and that could be a very good planning tool. Second part, if we know the number of deaths, which also indicate that in which state the investment in health system need to be done, where the attention need to be paid. If we can get that kind of data for districts, we can do really planning. So it's an important tool to understand the performance, plan for the future, and people need to know that how people are dying, and that will help in targeting vaccination, targeting strategy. So this is undoubtedly very important indicator, more useful than officially reported deaths.
Right, and we don't know, another challenge that we saw during that, you know, that time of the second wave was even to get tested was such a challenge. We know that in many parts of rural India, people were just dying, and nobody really said it was because of COVID, but it's suspected because, you know, all sorts of talk was there, and many of the cases so went unreported of coronavirus, isn't it?
Yes, so there is no doubt that India would have a far higher death than officially reported. The only difference is what would be the multiplication factor. And it is also widely recognized that India needs to strengthen and improve its registration and recording system, and it should be really timely manner. Right now, we get information many months later, so we need to strengthen that. Of course, there is an urgent need for doing house-to-house survey, which can also identify excess deaths. So there is no doubt that we need to do more. We need to do urgently.
Right, I was just talking about, you know, if we go back and remember what it was like, and in terms of reporting. Dr. Banerjee, so if you could tell us more about, you know, this data that you've come up with, and what you hope emerges from this.
So first, I just want to kind of agree with many points that Dr. Laharia has said, which is that we don't know for certain that how many of these deaths are actually from COVID-19. It is worth saying that if you look at international data on COVID-19 fatality rates, then you would expect a very large toll in India, perhaps not quite as large as the excess death toll that we're seeing, but not very far off from that. So if you were to ask me to guess, I would guess that the majority of the deaths, the excess deaths, are from COVID-19, but I wouldn't be able to say exactly how many. So I would say more than half of those excess deaths are probably COVID-19 deaths, which largely have gone unrecognized. So I think that, as Dr. Laharia said, excess deaths is a far more useful measure of the impact. It tells us the scale of the tragedy in a way which official COVID-19 data can't do. It also tells us what's happening in different states in a much more honest way, because we find from this data that some states have been probably surveilling their epidemics much better than others. So we find that in some states, the excess deaths are not that much larger than the official COVID-19 deaths, whereas in other states, there's a huge difference between the excess deaths and COVID-19 deaths. And I think where we see a huge difference, we should assume that that's because in those states, death surveillance for COVID has been particularly poor. Now, I think there are lots of different reasons. It's worth saying there are lots of reasons why death surveillance for COVID has been poor. It doesn't necessarily amount to dishonesty. It could be that just routine death surveillance is poor, that the systems were not in place, that testing was poor. So there could be many reasons why a lot of COVID deaths have gone unrecorded in some states. But we do see very big differences between states. And we also see that some of the narratives about how some states have underperformed, some states have overperformed, are actually not correct once you look at the excess deaths data, because really COVID has hit the whole country very badly, but some states have managed to record more of the impact of the pandemic in their official data, and other states seem to have done a much more poor job of it. So that's another learning that we get out of this excess deaths data.
Right, that's very interesting. If you could tell us which states, because currently, there's been a lot of debate around the Kerala numbers and how the cases are still very high there, and the deaths that have been reported. But the authorities in Kerala point out that they've been very good at having the lockdown. The Sero survey showed that it was below 50% of the population that was affected, and that is why we're seeing these numbers increasing, because they claim that they're reporting the numbers a lot better than other states in which the Sero survey found that over 80% or 70% of the population may have been affected by COVID.
Yes, I think that's undoubtedly true. I think that where you have had better managed epidemics, in the sense of where the spread has been limited, you're going to see continuing spread, because we know that if you have more susceptible people in the population, then it's going to be easier for the virus to continue to spread. And I have no doubt that in Kerala, the reason that you've got continued spread is precisely because mitigation to kind of reduce the spread has been more successful. And if you look at the excess deaths data from Kerala, you see much the same story, although there have been excess deaths, and in my estimates, actually somewhat more than has been claimed by other people. You still see that Kerala stands out as one of the states which has had the least mortality, least excess mortality during the pandemic. And for me, that just adds evidence to the claim that actually the pandemic has been held in check in Kerala in a way which wasn't managed by many other states. And so you see these variations between states, and the excess deaths tell you a story about how COVID has spread, how much it's been kind of held back, or how much it's been allowed to spread kind of rampantly. And you often see that that matches up with what you see in Sero survey data as well.
All right. And finally, Dr. Laharia, now what does this mean? We've been talking about a possible third wave and numbers increasing by the end of August. And again, this data is very important for that. What is your, outlook right now?
So what we need to remember that excess deaths are a far better and important indicator for performance, health system, and especially hospital care. As far as the third wave is concerned, it depends upon how quickly we can vaccinate people, how people are adhering to COVID-appropriate behavior. Are we doing targeted strategies? Are we doing effective micro-containment approaches? So all of those will determine the scale of third wave. We know that in the pandemic, as long as virus is circulating, which is a reality that virus is circulating, there is a risk of or chances of a rise in the cases, and that would be termed a third wave. We are hearing some projections or predictions which are difficult to verify whether that will be the right prediction. But we need to remember virus is circulating right. All states. We have also seen in between that the R effective had gone up. So there is a possibility of third wave, but we can hope, since Delta has caused the second wave in the country and same variant cannot cause subsequent wave, that vigorously. So the subsequent wave would be relatively smaller than second wave. That's the only assurance we can have, unless there is a new variant emerges.
All right, and basically the message is to increase our vaccination rates and cover as much of the population. Thank you so much, Dr. Banerjee and Dr. Laheria, for joining us on the program. Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that many of you have about vaccines, about COVID, about immunity, questions that you often look up online and Google. And to answer those questions, we're joined by Dr. M. Vali, Senior Physician at Sir Gangaram Hospital. Thank you so much, Dr. Vali, for joining us to answer those questions. Well, since the focus is on the vaccination drive and how everybody should get the vaccine as soon as possible, a question people often look up is how long does it take to develop immunity after a COVID vaccine?
Well, very frequently people want to know this, and it is important to know, yes, because it limits their movement and also it tells them when they are need to go out, move out. So after the jab or vaccination, it's roughly 2 weeks the vaccine starts performing its work and giving this adequate protection, which we call is immunity. And this is very but roughly you can say 2 weeks after that the immunity starts building up and it progresses, it builds up and it stabilizes to be there for protection, which we call as immunization, and the vaccine takes over the immune system. And the same kind of immunity is also seen when the people suffer from regional COVID infection. So both ways one gets protected. But when we talk of first dose and second dose, that is very important.
Yes.
And it is important because after one dose, the development of the immunity is not complete. Say one study done in UK showed that 33% and 88% after second dose. So second dose becomes very crucial, very important, and it is add-on. So this is very important to know rather than knowing when get immunized and then it starts building. So one has to complete both the doses as per the schedule given.
That's right. But even after getting both doses of vaccine, doctor, if you could just explain to viewers that you have to continue being careful. It doesn't mean, you have some armor against the infection. You could still get infected. The hope is that it will not be a severe infection. So continue following the protocols.
Yes, that is what is being discussed even today with reference to Maharashtra's infection, which were seen in Raigad, Ratnagiri and other places, Jalgaon. And they were cases which were vaccinated, and in them the infection was also seen, which you call as breakthrough infection. And 66 cases were studied till today, and out of that 18 were single vaccinated and 10 were doubly vaccinated, and yet they had the infection. So we have to observe the COVID appropriate protocol, and that is the best vaccination, and that is a must, and we cannot avoid on the pretext of being doubly vaccinated. And whenever we go to crowded places, close contact settings or spaces with poor ventilation, these 3 C's one has to remember: crowd, close contact and confined cases with limited ventilation. These 3 C's are very important to observe COVID behavior.
Right, doctor, and something of a repetitive question, but another question that people often look up is, does the presence of antibodies mean that a person is COVID immune?
Absolutely, I'm against answering this question. Because you can't detect specific antibodies which are specifically protective against the spike protein. We suffer, we develop one type of antibodies, we get vaccinated, we get another type of antibodies, and it is, last time I told, it is not geometrical, it's not proportionate. So we should not, in fact, encourage these kind of tests, And vaccination means protection. Vaccination means immunity. Some people say, I had no fever. My other family member had fever, so he might have developed better immunity. These are not the criteria. So once we get vaccine, the fact is antigen is injected, and when the antigen goes into the body, it does its work and gives immunity. That is antibody.
That's right. And so the main point is to just go ahead and get vaccinated and get protected against COVID. Thank you so much, Doctor, for joining us.
Welcome.